You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello, and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Well, a lot has happened in the past couple weeks, and the world's been busy. I've been busy, and it's probably been one of the darkest times I think many of us will ever see in our lifetime with this resurgence and additional wave of the coronavirus pandemic. So, the big discussion lately has been all about vaccines. Which vaccine? Do you get the vaccine? What about vaccines? And what I'm going to try to do today is just give you a brief history overview of vaccines and try to do my best to try to break down, what an mRNA vaccine is and what the difference between RNA and DNA is, and then also some of the differences between the vaccines. I personally just did receive the vaccine 2 days ago on Friday, and to be honest with you, a couple months ago, if you had asked me, numbers were decreasing. The vaccines, had been tested and then were coming towards approval. And I had said, I'll wait and see. But with the worsening numbers that we have here locally in California, I have call coming up. In my opinion, the risks and any risks that could be associated as far as, side effects, short-term or long-term with the vaccine definitely were outweighed by the high risks of the coronavirus and getting sick, either death, although those numbers are low, the numbers are higher here than in other countries, and also a lot of the long-term side effects that we're seeing in patients that even recover from coronavirus. So, historically, the United States created the vaccine agency in 1813. And there were a lot of very prominent scientists and physicians, over the years that really helped create vaccines sort of as we know it today. Jenner, back in the 17 to 1800s, found that cowpox could actually protect people from smallpox. And Louis Pasteur, who was really paramount in coming up with the rabies vaccine. There were the first law passed in our country in the 1850s in Massachusetts requiring vaccinations for school children, and then Loeffler with diphtheria, and then the world in the U.S. was really hit with polio epidemics. This was back in the 1890s, where the first epidemic hit Vermont, and 18 people died, and 132 people were permanently paralyzed from polio. And then jump forward to the thing that a lot of people are more familiar with now, approximately 100 years ago, the Spanish flu pandemic, which killed millions of people across the world. And, they tried very, diligently to make a vaccine at that time, but it wouldn't be later until the 1930s when they were able to develop an actual vaccine for that influenza A strain. So money and time has gone into this. It was actually entertainer Eddie Cantor on the radio back in 1938 that actually recommended people send in money, and it was 2.6 million people actually mailed in dimes to the President of the United States in an attempt to raise money to fight and develop a cure for polio. And then it was 1945 when the first influenza vaccine came out. This was approved for military use. It wasn't until the next year, 1946, when it was approved for civilian use. And then everyone's very familiar with Jonas Salk and the polio vaccine that came out. He initially started by vaccinating himself and his family, just to show that this was safe. There was a little bit of a pushback. So there are some, stories and histories of some, negative problems that occurred in the idea of vaccination. So, in 1955, polio vaccinations were actually suspended, and this was 6 different manufacturers were making vaccines, and there were approximately a dozen deaths and hundreds of patients were paralyzed, but it was felt that they didn't actually follow Jonas Salk's instructions on how to accurately kill the virus. So, they were inoculating people with live virus. the measles vaccine came out in the MMR, which most people are familiar with, measles, mumps, and rubella vaccine, which was produced by Merck. This was first licensed in 1971. And then in 1980, there was a declaration that smallpox had been eradicated. 1994, Pan America Declaration that polio had been eradicated from the Americas. So, I mean, these are huge, huge achievements in the health of our world and the health of our country and, protecting citizens. But I think, the big thing where, and I'm sure, vaccines always stir the pot and bring up a lot of, issues with certain people depending on their feelings. But, just historically where a lot of the stories and negative connotations about vaccines came out from, there was a study back in 1998. This was published by Wakefield and 12 total authors. This was in the Lancet. And what they found was the MMR vaccine actually could lead to autism. And this is where a lot of people got concerned about vaccines being bad. Now, it was found out sometime later that a number of the subjects that were recruited for that study were actually recruited from a lawyer who had a lawsuit against a number of vaccine manufacturers. And, following the exposure of all this information and data, 10 of the 12 authors retracted the data. The Lancet retracted the paper, and this Wakefield was banned from practicing medicine. So, that story still holds true, this feeling that vaccines cause autism, but it was really proven that that was falsified information, false data, not very accurate. And then the HPV vaccine, which has been talked about more commonly in the past decade or so, that came out 2006. So, here we are, and, a lot of the vaccines, were ways of using the prior organism and developing, attenuated strain to produce some sort of, immunity in the host. But now there's this new thing, this mRNA, and this is the thing that really, I think, scares, a lot of people. They hear about RNA and they're thinking DNA and, how it's going to change my body and mutate. So I'm going to do my best of trying to explain, DNA, RNA in a very simplistic manner, but just so you have sort of an idea of what happens. So, DNA, obviously, that's the makeup of us, of basically every living organism. So we have, as humans, we have 23 pairs of chromosomes. So there's 46 total chromosomes. And in that is all of the important genetic makeup that makes us, for the most part, who we are, what we look like, and things like that. So there's over 21,000, genes. And when we talk about DNA, it's this, double helix model. And there's opposite these pairs. So, A always combines with T, C always with G. So if you remember that from science, you have this kind of twisting, and opposite, every adenine is a thymine, and opposite every cytosine is a guanine. But it's the kind of organization, combination, and the sequence of those that make up particular genes. And all of this is coded on all of these different strands of the DNA molecules. Now, these are all within the nucleus. So we get half from our mom, half from our dad. They're all in the nucleus. They make us sort of who we are. Now, to get that out, what do you do with that information? So what happens is there's two things. We have transcription and translation. So in the nucleus, what happens is this transcription occurs where a part of the DNA molecule segment gets translated, and that translation goes on to RNA. And that then has basically the mirror image of that DNA strand. Now, the only major difference in the DNA and the RNA is that you also have your cytosine and guanine, and you also have your adenine, but instead of thymine, you have uracil. So that's the only difference when you're looking at these letters, and you start to see sometimes on these diagrams, you'll see, ATCG or AUCG, is that opposite an adenine in RNA is a uracil, where opposite an adenine in DNA is thymine. But all of these things code for things, and these are things that we need. So, once that messenger RNA can get transcribed from the DNA, it can leave. And then once it leaves and it goes into the cytoplasm, then we have to have something what we call translation. So you had your transcription inside, translation outside. So what happens is you need this tRNA. So it's a transcription RNA. And if you remember back, actually, the T, it forms this kind of T shape. So the way it wraps up, it forms this T shape. And it finds this little patch of genetic information. So it's not a whole chromosome. It's not all your DNA. It's just a little portion of the DNA. And then it binds to this mRNA. And then it translates each 3-base triplet. So for every of those letters that we're talking about, that's a base. And then every 3 bases is a triplet. It can actually then make an amino acid. So, you hear about bodybuilders and amino acids, and you hear about foods that are rich in amino acids. But, those amino acids are what then build these protein molecules. So what will happen is that for every 3 bases, you form an amino acid. And this occurs with ribosomes. So it's the ribosome, actually, if you remember all these little parts from science class, but the ribosome moves along this messenger RNA, basically attaches to it, and as it goes across, and then it translates these little pieces of this genetic information into a protein. And it's believed that then that protein will do stuff in our body. In this case, that protein is going to help us not kill off the infection, but that's a big misconception, is a lot of these vaccines don't necessarily make you immune, but if you get the vaccine, it allows your body to develop these antibodies. So when you are exposed, your risk of death is less, or even your risk of symptoms is less. So many people may just have an asymptomatic, essentially, infection. Your body already has the antibodies, and it fights this off. So that's sort of the goal. So this messenger RNA does not go into the nucleus. This is basically just a way of getting that messenger RNA, which your body would typically make from your DNA to produce proteins for your body. And it's introducing this messenger RNA to allow your body to make this protein so that when or if you then get exposed to the coronavirus, that your body already has this ability to then fight this virus off and either prevent you from dying or prevent you from getting very, very ill. Because every year, people that get the flu vaccine, again, it doesn't make you immune. I get the flu vaccine every year, and I've had the flu a couple times. But the idea there is that if you have a vaccine, that the severity of your symptoms is going to be a lot less. So that's really the goal. And I think more importantly now, as we're seeing this additional surge, that the numbers everywhere in the world are just increasing astronomically. And, our hospitals are taxed. There's the discussions of, care being rationed. I mean, if you have, a trauma victim, if you have a heart attack, if you have a stroke, I mean, the reality is there's hospitals that don't have availability to take care of you. So you may have to be taken to a further hospital, or maybe, the best hospital is full and, you have to go to a hospital that's not as technically skilled, or maybe, the equipment that you might need, a ventilator or other stuff, is not available because it's already being used on patients, that are sicker. And that's the scary but unfortunate reality of the world that we're living in right now, today, that, many, many places in the world, hospitals have stopped elective surgery because just don't have hospital beds, don't have nursing staff, don't have physicians, and then as physicians are getting sicker and sicker because they're treating these patients, this vaccine is that first kind of glimmer of hope, I think, in healthcare in the past 9 months, where, you've heard a lot of elation in healthcare workers getting the vaccine because they think this is that first chance that we might be able to protect those healthcare workers that have been really at risk on the front lines with limited PPE and having to work day in and day after, with long shifts and being exposed to all these patients. And this may, potentially offer them that decreased risk of, getting sick, getting very ill, and potentially dying. Because we've had, one death is too many. We've had over 300,000 deaths in the U.S. and, a number of healthcare workers that have died just doing their job, taking care of people. And, any one death is one death too many. So now we have these two, vaccines. And, a lot of people have asked, well, which one are you getting and what's the best, and, things like that. And I think Dr. Fauci, said the best. He'll get the vaccine that's available to him at the time because he believes in the science. For me, I had the availability of getting the Pfizer vaccine. Again, that was available. And to be honest with you, I think the Pfizer vaccine is going to be the vaccine that's going to be distributed to most institutions, healthcare workers, for a number of reasons, and the Moderna vaccine and possibly other vaccines that may come out, may go out to more of the public. So similarities, differences. So the Pfizer and the biotech, vaccine that came out, this was approved for use December 11th, 2020. The Moderna just slightly after December 18th. So just one after the other. Pfizer's vaccine was recommended for patients over the age of 16. Moderna's for over 18. And then when you look at the prevention of symptomatic infection, the studies that they presented, Pfizer's was 95% effective in preventing symptomatic infection. Moderna's 94.1. But I mean, still, you're getting an A if you're grading this. I mean, this is excellent news that it's going to be that good at preventing the risk of a symptomatic infection. So when does this essential protective immunity begin? So Pfizer's data shows that this starts about 7 days after the second shot, and they recommend that the second shot be given at 21 days. Whereas Moderna's vaccine, what they found was that their protective immunity begins around 14 days after the second shot, and they recommend their second shot 28 days after the first shot. Now, dosing-wise, there's 30 micrograms per dose in the Pfizer and 100 micrograms per dose in the Moderna. And we're not necessarily sure, is more better or less or better, so that's going to be things that are going to come out. But, I think the big issue, which is why I think Pfizer is going to be distributed more to healthcare workers and those large institutions, is the next two big factors. So storage. So the Pfizer needs to be stored at negative 94 degrees Fahrenheit, where Moderna's only needs to be stored at negative 4 degrees Fahrenheit, which, any normal refrigerator freezer, can tolerate that. But you need specialized freezers to store the Pfizer vaccine. Once it's brought out to thaw, it has to be used within 5 days. And their minimum order, from what I was told, is close to 1,000 doses. I think it was 975 doses was their minimum order. And you can get 5 doses per vial. But the really good news is there's been a lot of reports of people getting an extra dose or two out of each vial. So that just means there's even more doses available. Whereas with the Moderna vaccine, you can store it for 30 days in the fridge. Within 12 hours at room temperature, it needs to be administered. You can have a minimum order of 100 doses, and you get 10 doses per vial. So, if you're a doctor's office, it's going to be a lot more easy for you to then store that and buy a smaller sample and then distribute it to your patients, where, these hospitals that have to inoculate hundreds, if not thousands of healthcare workers in a short span of time, they can store this and use that Pfizer vaccine quite quickly. So, the concerns of, anaphylaxis, those numbers have been quite low. So when you look at percentages, I mean, you're talking less than 1%. Some of that was felt to be due to one of the ingredients. And there's been some other reports. But again, this is almost like another, study phase in the sense that healthcare workers, are really getting this in large numbers, and we're going to be able to see, what sort of risks and side effects. Still, no one's 100% sure. So these weren't tested in pregnant or soon-to-be pregnant females or females that are lactating. There have been a number of healthcare workers, that were pregnant or lactating that have chosen to get the vaccine. So it would be really important to follow them and see if there's any untoward side effects. But again, that's the next sort of, phase of the study. And then the hopes are that, as these vaccines get out to more and more people and we develop, more of an immunity in the population and more control of the virus, that, the hopes would be within a year or so that things start to go back to normal. The side effects that people talk about most commonly, these are just the low-grade temperature, soreness, fever, malaise. I mean, this is your body basically being turned on to create this immunologic response. Me personally, the only thing I had 12, 24 hours later, my arm was quite sore. So aside from that, I didn't have any other constitutional symptoms. This was the first shot, and, things went off seamlessly. So I will keep an eye on those and, probably get back to this topic in the near future, because I know this is a hot topic and lots of people, friends, family, patients have been asking lots of questions. So I'm trying to kind of put all this in one little spot so people can access this and get a little history on disease and vaccines, and more of an understanding, and again, a very brief understanding, on DNA, to transcription to mRNA to translation through a ribosome to a protein, which produces an antibody that can prevent this severe disease from breaking out in your body should you or when you become exposed to coronavirus. And then also the similarities and differences between both the current Pfizer and Moderna vaccines that are available. So in the meantime, like I always say, stay safe, but definitely at this point in time, not only stay safe, continue your social distancing, continue to wear a mask, continue to, wash your hands, limit travel. And if you do, start to come down with symptoms, isolate yourself from others, talk to your physician, talk to your provider, get tested. And we will get through this. The light at the end of the tunnel, we're hoping is there with this vaccine. And then hopefully the numbers at some point soon peak and then start to drop off. And then hopefully the worst is soon behind us. But unfortunately, as of today, the worst is not over yet. So until next time, I'm Adam Rosen. You've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.